Thank you everybody for joining us today. We realize that COVID fatigue is now also being accompanied by webinar fatigue, but we hope that our discussions will make you feel it was worth joining today. Let me begin by introducing myself and Oxford Policy Management, who are hosting this seminar. I'm Ruhi Salth. I specialize in public health and work as a senior consultant with OPM. OPM, as some of you may know, is a public policy consultancy with its roots in academia. It was started in the 70s in Oxford University by a group of postdocs who wanted to do more applied work, helping newly independent countries in the framing of development policies and implementing their programs. It became an independent consultancy in the 90s and now has offices internationally, with the India office, which is holding the seminar based in Delhi. Now, moving on to the reason for holding this webinar. We completed a study, we at OPM completed a study improving HABIT, that's improving habit, households, attitudes and behaviors to increase toilet use, last year in rural Bihar. The study was funded by 3IE and in partnership with World Vision India and Ideas 42. The study was conducted at the peak of SBM's activities towards trying to achieve the goal of an open defecation-free rural India last October. We found a big increase in toilet usage amongst our focus households who had functional twin pit latrines along the lines of the SBM design. Between June to November 2018, toilet usage increased from around 60% individuals at the baseline using toilets habitually to more than 90% at the end of the intervention. The increase, however, occurred in both our intervention and non-intervention households, not surprisingly, given the intense SBM activity on the ground at this time. So that is the good news, the great news. So what's the problem then? Well, the study also threw up a number of other findings, which made us mull as to what insights we may find which can help us to minimize slippage and ensure that the gains of the SBM are not dissipated. Towards this, we will be discussing in this seminar today issues that need to be addressed in three broad areas: infrastructure, waste management, and social and behavior change, each of which will be headed by our three panelists, Radharani from the World Bank, Raman from WaterAid, and Radharani Mitra from BBC Media Action, respectively. Before we move to these three discussions and detailed introductions of the panelists, we would also like to get some idea of you, our audience. Who is it that we are speaking to? Towards this, I would ask you to please look at your screen and you will see something popping up. So please now do select the option that best describes your affiliation and then press the submit button. In a minute or so, once Computer G does his work, you will see something flashing up on the screen, and this will give us a breakup of the audience and what their affiliations are. So let's just give it a minute to do its work, and hopefully that graph should pop up. Assuming, of course, that, yes, okay, there it is. Well, so it looks like non-profit organizations account for around half our audience, which is great because we really want to look at the nature of the implementation and look at actual practical steps which need to be put in place and on the ground work. So that's great. What is a bit disheartening is to find that we don't seem to have anybody from government, but we aim at the end of this webinar to write up a policy brief which we will be actually sending to government, and if possible, maybe also try to present at some linked fora, so that the discussions and your questions, the answers, what the panelists say, will hopefully reach some government agencies or people who are, in charge of looking after the future steps of the SBM. So one more insight we want to get now from our audience is what the studies you may have been part of or read indicate to you as being the main barrier to toilet use. So again, following similar steps as last time, if you could please just go through the options and choose what, in your opinion, is the main barrier, the one main barrier. Of course, then you may think most of them are barriers, but the one which you think is the main barrier to toilet use. So if you could pick on one of those and then submit. And again, that should then give us an idea of what the audience thinks is the main barrier. You don't have to worry too much. We're not going to do a pre and post kind of testing of whether you've been listening to what we are going to be discussing. But it would be nice to know what your thoughts are on the main barriers. So hopefully, if everybody in the audience has submitted. Okay, so the biggest barrier showing up is 40% almost of the audience thinks that inadequate knowledge of the health benefits of sanitation. So pointing very importantly to SBCC and its role. The second highest barrier seems to be with regard to issues with access to water. And the remaining are all at 13% with regard to the toilet infrastructure, waste disposal or pit emptying, and lack of access to toilets. Okay, so that's really good. That sort of lays out quite a few of the reasons which we'll be discussing now. But before we actually start, coming to some housekeeping first. This webinar is being recorded. So we hope everybody is okay with that. That's the first thing. Second, if you have any questions when you're listening to the panelists, please post these in the Q&A box, which you, the audience, should be seeing on your screen. The questions will either be answered by a message by one of my colleagues, or some of them will be taken up, and I will then address them to the respective panelists to respond. As I mentioned earlier, we also plan to come up with a policy brief after this webinar, and we hope that any unaddressed queries will be answered in that. The brief will be widely circulated, will also be posted on OPM's website, so you can access it there. If you would like more details of our improving habit study, again, you can get the report on OPM's website and also on 3IE's website. So now moving on then to the webinar itself and to the three core areas that we've got our panelists who will be discussing each of these. So coming to the first aspect of the discussion, this is on infrastructure. The starting point for this discussion from our improving habits study is that amongst the few individuals, which was less than 10%, that we found were resistant to habitual toilet use. And remember, this was a subset. These were households with functional twin pit toilets. So among the 10% of these households who were resistant to habitual toilet use, while the rest had moved on to this toilet use, what were the reasons? So first of all, we found that the lack of use was more common amongst males than females. Further probing revealed that one of the main reasons was the lack of toilets at the place of work, which is the case in the sense that men usually head off early in the morning, early in the day. They could be heading off to the fields or elsewhere, and then don't have access to toilet. Another reason cited was inadequate water, the effect of which was stated to be much more during summer months. Other reasons given in the qualitative part of our study and also stated in a number of other studies were aspects to do with the toilet itself, given the nature of construction, etc. Of course, these are all issues which require action at a number of levels. And to talk to us about these different levels, I invite Raghavaneti. Just to give a bit of introduction first, he's a senior infrastructure specialist working with the World Bank's Water Global Practice based in New Delhi. Of relevance to our webinar is his leading of the world's largest sanitation program financed by the World Bank, namely, of course, the Swachh Bharat Mission Support Operation, to the tune of $1.5 billion. He has also been leading India's Program for Results Operation of the World Bank in the context of the rural sanitation, water supply and sanitation sector in Maharashtra. So Raghavaneti now to give us his views on what can be done at the level of infrastructure issues to sustain the effects of the Swachh Bharat mission. Over to you, Raghav.
Thank you, Ruhi. Thank you all the participants for joining us today. First of all, let me thank OPM for inviting me for this webinar to share my perspectives and experiences. On the occasion of this World Toilet Day, and in the backdrop of SBM1 moving to SBM2, this is an important topic for our discussion. As you all know, in India, about 107 million toilets have been already built. There have been massive efforts for behavior change at the village level of the individuals and also to achieve open defecation-free environment. There is also effort now going on to reach the unreached population so that the access will improve to every citizen in the rural areas. The ministry has also given a lot of guidelines, technical guidelines, as well as manuals for training the masons, etc. So in this context, if you want to see why the toilets are not being used, I think we need to go beyond the physical infrastructure of only toilet. Of course, the basic requirement is to improve access. Even that access has to be of quality. Beyond access, of course, we all know that changing the behavior is important, and also it is important to sustain. That is with respect to the toilet and its surrounding. But then going beyond, if you look at the village environment, managing the waste is important so that no environmental harm is caused. So my other panelists will speak about these two other issues. Beyond these three, access, behavior, and managing waste, we need to also look at the institutions. How is the institutional system performing? That is what we do in the World Bank when we support the government. So let me focus on the first aspect, which is infrastructure. When it comes to infrastructure, toilet access has to be improved. There are four elements that needs to be kept in mind. One is access. Second one is functionality. Third one is hygienic situation of the toilet. The fourth one is social acceptability. So let me go one by one to explain you what we found and what can be done. With respect to access, it's always better to have access at the individual's premise. Then the usage is likely to be more. But it may not be possible always. There could be some poor households who may not have space within their premises. For them, we know the solution is either public toilet or community toilet. So when it comes to the latter, it is important to ensure access even to them. That comes in the form of the nearness to the village, or the approach, or the facility being locked when it is in need. So these need to be fixed. How can we fix that? By having proper operation maintenance system, making somebody responsible for that. The second aspect is functionality. With respect to functionality, it's important to keep that in mind at the planning and design stage itself. Some of the factors to consider are space, ventilation, water availability, privacy aspects, and also reflecting on the needs of the community in the form of, say, hand washing facility or any facility like bath and washing facilities if required. Then the other aspect is about how do we really fix that? The approach is to see that whoever is building the toilet, it could be either the household or it could be a mason, they have proper skills and knowledge. On that, again, various guidelines have been given by the ministry, and they need to be ensured that the guidelines are transmitted to the people who are in need. Whenever some facilities are broken, they need to be fixed. This issue comes up mainly in the community toilets and public toilets. Again, how do you fix that? By having proper system of management for community and public toilet. There are a number of guidelines again available, and there are good practices. Even there are practices of private sector participation in this, which can be adopted. Then whatever is built, it should be easily maintainable. So again, it gets reflected in the form of planning, design, simplicity, etc. Then the third element we need to consider is about hygienic situation. So this is possible and easy in the case of household toilet, but it may be difficult in community and public toilet. I've seen during the number of field visits that many of the community toilets have been in disuse. Again, so this aspect of promotion of community toilets is now being focused by under SBM. So it's important that the institutions work well, meaning at the GP level, at the block level, at the district level, they work together to have a proper system of management to see that this community and public toilet will work properly. Then the last aspect is about social acceptability. We discussed as part of the results of habit just a while ago, Ruhi has presented that, and also it is reflected in the polls that we have come up with, that the individual should understand the health benefits of the toilet. Then only there will be acceptability and there will be usage improvement. Not only this, I mentioned earlier that we need to reflect the desires of the community. For example, in Punjab, when we were financing the toilet, we ensured that the toilets are built along with bath facilities because public over there want to have bath facilities along with them. So when we did that, there was a lot of usage. So we need to focus on that. So all these aspects are monitored in our National Annual Rural Sanitation Survey. 3-time survey was done. There are procedures to monitor and measure this as well. And finally, please remember that India has to reach SDGs. Under the SDGs, 2 elements are important. One is improved toilet, which means the human contact with excreta is not there. Second, ensures safely managed toilets. I hope Mr. Raman will talk about that. That means waste in the environments are properly handled so that no environmental harm is caused. Thank you very much. Back to you, Ruhi.
Thank you, Raghava. So one of the things which Raghava mentioned is become now increasingly important, of course, nowadays in the context of infrastructure, which is hand washing facilities. So with COVID, of course, there's so much of emphasis on this. So in one sense, it is actually quite, there is much hope that this focus on sanitation and hygiene will sort of probably help bring back the focus which needs to be put on these issues. And the focus will sort of continue in this post SBM phase as well. Continuing the discussion now with the other issue of importance, which is the fecal waste management. So as Raghava said, of course, we need to make sure people increase the use of toilets, but then what about the next step? So the starting point for this discussion on fecal waste management from our study was the finding that a lot of households did not have any knowledge of the process of fecal decomposition in the pits. The result of this was that there was an early removal of the material and pits were emptied, and worse, the material was all disposed in open fields, almost akin to delayed open defecation. This lack of knowledge also has an implication for usage, which I will talk about when introducing the next discussion on social and behavioral change. But reports were also made by those who were working in the field, and also other studies have reported of many households in rural areas which have some sort of toilets which are not twin pit toilets, but because they want to delay emptying, they have kind of akin to septic tanks. And these are then emptied, and the fecal sludge again is either emptied out into the fields or emptied into bodies of water, completely obviating the expected public health gains of the SBM. So to talk about this, I now invite VR Raman, and he is the head of policy with WaterAid India. Of relevance to this webinar is his recent work looking at terrain appropriateness of toilet technologies and the pilots he has been part of on fecal sludge management, as well as initiatives on grey water management. So I invite Raman now to talk on what needs to be done in the context of fecal waste to contribute to the original broad vision of Swachh Bharat mission of a Swachh and Swasth India.
Thank you, Ruhi, for this introduction and invitation to this important discussion on the World Toilet Day. And thanks, Raghava, for setting up this very clear access infrastructure and then behavior, waste, and institutional issues as a kind of important kind of elements of ensuring toilet use as well. And I hope to Radharani, I'll have some pointers about behavior as well. So while I'm going to talk about the systemic solutions for ensuring sustained toilet use, so that is where the waste management comes as one of the key elements. Before I get into that discussion, from some of our studies, like the rural immersion study that we did, two versions of that, and accessible and inclusive sanitation policy initiative that we did with Chhattisgarh government, and also promoting toilet usage trial in parallel to what OPM and the World Vision and others were doing. We were also doing a similar initiative using the a specific behavior change framework in rural Karnataka, and also some two editions of the toilet technology studies and an advocacy initiative of the FSM. There are some important insights that are coming, which further Radharani may be able to discuss in detail, but I'm just flagging them before I go to one of this is the coverage question. So remote and hard to reach habitations and villages are yet to have the coverage in many places. For example, in Madhya Pradesh, they recently done tribal area participatory resource mapping. We found that there are the Madhya Pradesh government also in their survey found that there is some number of toilet coverage yet they have to complete. So they are into that mission, but it is important that other states are also looking at it. And similarly, workers of remote kind of workers in the rural, migrants in rural settings are also there to be understood, like the bricklaying workers or the mango orchard or the farm workers or the poultry farm workers, those kinds of people. Larger families which require more number of toilets, festivals and events done in the communities, and lack of or inadequate number of community or public toilets in the needy locations. All these are issues, and accessibility in terms of persons with disability is a major issue that is preventing toilet usage, and also female inclusion for some features of that, and transgender inclusion, those kinds of issues to be looked at, and target driven pressure of the mission boost the usage initially, but then the usage goes down when the pressure or the that coercion or whatever we call it, the social sanctions, they are not there. So what after the mission, how to kind of ensure that is also a question that comes up. And toilets that are affected by disasters, partly Raghava discussed that, and ownership of the people, sometimes constructed by contractors or GPs, that is not in the way people would have liked or wanted their toilet. That those kinds of issues are also affecting toilet use. And then some perceptions like toilets are impure and child feces, that can be handled easily and put up outside anywhere. Those kinds of social perceptions and cultural beliefs are to be addressed, because the toilet perceived as impure, sometimes they don't use the toilet, just built close to the household areas, because going there or using that as for defecation, they think that the household area also becomes impure. So those kinds of issues to be looked at. Coming to the main question now, the caste question is to be looked at. While we are, the anxiety of the people about their no knowledge about emptying, and as Ruhi said, periodic emptying that they do wherever it is not needed. That is definitely there, and also this anxiety has also led to one other problem of infrastructural gap, like large toilets being constructed, large toilet tanks being constructed. In one of the places that I visited, I've even seen 10 feet into 10 feet kind of pitch for the septic tank, and the depth was more than 20 feet. So that kind of large pits are also constructed. So those issues are there. So within that, we need to see one question of caste, which cannot be really ignored. So we need to put full care to have regulations and systems in place in order to avert manual emptying by specific caste communities at all costs, in order to stand in tune with the law of the land for prohibiting employing people as manual scavengers. So this is something that to be very, so in Watergate today, while we are observing the World Toilet Day, one of our important message has been around the sanitation workers and manual scavengers. So that is something I want to underline here. So coming to the rural FSM advocacy. So one of the important things is that people are aware about the periodicity to empty. And one other problem is that although the ministry has, as part of the Swachh Bharat mission, promoted twin leach pits and expected that emptying and transportation will not be required for an on-site sanitation solution like twin leach pits, in practice we find that many people preferred different other kinds of technology that required emptying and cleaning. The other thing that we also found was that in places where which is from village to a kind of town transition, transition to the census town, population density, lack of land, those kinds of things also has led to the limited kind of availability for constructing two pits and all that. So all these compounded together for moving into the choices of toilet substructures which require periodic emptying. That is one part of it. And second, we also found that since people's understanding of toilet technology would also require some kind of transport, otherwise they will throw it on the field, and the meaning of sanitation and the environmental hygiene will not be maintained. So for all this, advocacy for rural sanitation was rural fecal sludge management was needed, and we came up a couple of years before with a policy note, and that led to a task force on rural fecal sludge management, and then we proposed a pilot of rural fecal sludge management in select states of the country. And that was something very important about the Swachh Bharat mission, which accepted that in the 10-year strategy for sanitation, also as part of the SBM 2.0 guidelines, fecal sludge management and grey water management kind of initiatives got important prominence in addition to the retrofitting and related corrections of the toilet infrastructure wherever it is needed. So the pilots that we are doing now in Indore of Madhya Pradesh, in Kalibilod Gram Panchayat, we are covering, because that is also one problem about the fecal sludge management understanding, because we always think that fecal sludge management needs to be a large kind of a thing. So we need to for the rural areas we need to scale it down to bit. So for a 50,000 population, for a 3 kiloliter per day kind of a load, so what is the kind of size that a plant would require? So a lot of thinking was required in this process. So based on that, H&M Foundation funded the Indore Madhya Pradesh plant, and it is about to be commissioned. And from 3 Gram Panchayats, around 50,000 population, this plant will be in a month time or so that will start to function. And then there will be an emptying process, a mechanized emptying process, transportation process, treatment process, all will start as part of this, because these areas are having a large number of septic tanks and periodic emptying are important. Similarly in Durg, of Chhattisgarh and two places, Patora and what you call Kumari Nagar Panchayat. So we have also tried, sometimes the rural areas, the feasibility for a fecal sludge management plan may not be there. So how can we do a model of mixing up small towns and rural areas together? So that is how the Kumari model of Nagar Panchayat plus 7 Gram Panchayat came in, around 67,000 population, 6 kiloliter a day. And this plant is being funded by the BMGF and it is getting ready. Similarly, in Patora Gram Panchayat, again 3 Gram Panchayat, around only 15,000 population. So this has only 9 kiloliter per a week kind of a fecal sludge load. So these are, issues to now technical agencies and organizations to understand how to make the clustering and, bringing together the Gram Panchayats and, make an administrative and institutional infrastructure for managing these issues and, putting very clearly who will manage what kind of an arrangement needs to be done. And finally, we are also doing in Amethi of Uttar Pradesh, Benipur Gram Panchayat. This is covering a cluster of 11 Gram Panchayat and 74,000 population, and again 3 kiloliter a day, 3 KLD, and this is also funded by BMGF and we started the work recently. So what we are seeing is, very importantly, unless and until, I'm finishing, Ruhi. Unless and until the pilot plans, after this, lot of rural areas would require this kinds of initiatives. Then only the people will have a understanding of the systems where they can call to get the emptying processes done and who will take it away, where to take it away. Those kinds of issues are there. And finally, I will again underline this. The caste question, we need to take care to have regulation and averting manual emptying and cleaning of toilet substructures in all costs. Thank you. Thank you.
So, thank you, Raman. Two really interesting points there. One, of course, about the caste aspects. So in the intervention that we implemented, thanks to Sulabh, we had decomposed material from pits. And it was very clear that it was just dry, just like some sort of dry mud. But even so, there was a lot of hesitation by households to touch it. And after our intervention, where we try to reduce anxieties about what the pit contains, a lot of households, compared to before, at the end of the intervention, said that they had less anxiety now about the pit contents. However, the percentage of households who had said that they would get somebody else, and that somebody else is typically from a lower caste, to clean the pit rather than themselves, did not change. So even though the anxiety reduced, even though they were aware of what the pit contained, that sort of is so deep-rooted about, the being particular groups who do this emptying, that that's something really difficult to dislodge. And that, of course, brings us to the social and behavior change. So coming to that third panel now. The starting point for that from our study was the finding that despite our intervention and the Swachh Bharat mission's efforts on the ground to increase knowledge on the time taken for pits to fill and the manner of the process of decomposition, we found that 23% of the households at the end line still underestimated the time that it takes for a pit to fill. So which means that they thought that the pit would fill much earlier than it really does fill. And because of this fear of the pit filling, then households felt that they needed to ration the use of the toilet, and that it should be women or it should be, people who are sick and things like that. So the point that Raman raised in his, while he was talking about the fact that there was such a lot of intense focus of the SBM and so much, in many ways, social pressure and different sort of coercions within the community itself to adhere to a particular behavior. So under that pressure, of course, households may have begun using toilets. We saw toilet usage went quite high up. But there is a possibility that when we look at all these underlying aspects, underlying barriers to toilet use, like the knowledge about the pit emptying, the knowledge about the time it takes for it to fill. So unless these underlying knowledge and attitude barriers are addressed, the question arises about how much slippage there has been and will be in the use of toilets. During our formative study, as I told you that, there was this lack of knowledge influencing the use of toilets. Similarly, the fact that people did not know, not just the filling time, but not knowing that once the pit is left closed for some time, then there's decomposition, the material becomes non-pathogenic, can be used as manure. All this sort of caused anxiety regarding emptying and the, lot of hesitation to use the toilet. So these are all aspects which, of course, social and behavioral change needs to address. And to talk on that, we have Radharani Mitra. She is the Global Creative Advisor at BBC Media Action. BBC is an international NGO that uses media and communication for development. She mines insights, shapes strategies, and tells stories using new and legacy media to bring about social and behavior change. Of relevance here to this webinar is her work on urban sanitation, including very recently that on Navrangi Ray, a television serial, which actually managed to entertain people while dealing with the delicate topic of fecal sludge management. And her work has won several Indian and international awards. I pass over now to her to tell us more on how SBCC could be implemented, such as to ensure that whatever gains have been made sustain and to reduce slippage. So over to you, Radharani.
Thanks, Ruhi. Very glad to be here to share some of my experience and learnings from BBC Media Action's work on sanitation. Since 2015, we've been supported by the Bill and Melinda Gates Foundation to provide strategic communication support to both the Department of Drinking Water and Sanitation, that's DTWS, and the Ministry of Housing and Urban Affairs, MAHUA. Like the rest of our SBCC work, our sanitation portfolio has also been using a human-centered design approach that's rooted in evidence, powered by insights and big ideas through both new and legacy media platforms, and that's television, radio, print, outdoor outreach, and of course digital, both online and mobile. I'd like to make 4 recommendations in the next 8 minutes. My time starts now. And these recommendations are not about the need for SBCC, because that has been established, but how to make SBCC happen. My first recommendation is that we can't take the foot off the SBCC pedal, and it needs fuel. To build on the gains of the Swachh Bharat mission, the engine of social and behavior change communication has to keep running, and that needs resources, both human and fiscal. It can't be done sporadically, and it's simply not enough to just design effective communication solutions. They have to be implemented well, and therein lies the challenge. Not that it can't be done, and I'll share 2 instances with you. We created the Shaucha Singh series of 2-minute radio dramas for DDWS in 2017. So that's about rural sanitation, to debunk myths and misconceptions that stand as a barrier to toilet use. DDWS has really stood behind this campaign. We started with 10 outputs in 10 languages, which were disseminated through robust, well-implemented media planning and buying. DDWS has stayed with this property, having invested in it significantly to add newer messages over time. BBC Media Action has also collaborated with DDWS, supported again by BMGF, to create an IVR-based mobile training course for Swachhagrahis called SBM Academy, to help them do their job better, to sustain the successes of the Swachh Bharat mission. Since the Minister Jal Shakti launched SBM Academy just over 3 months ago, 44,000 people have started the course, and nearly 28,000 have already graduated across 9 states. Currently, we are rolling out training for 2.5 lakh Swachhagrahis in these states in close collaboration with both the states and the Ministry Department at the center. But these efforts need to be sustained well after donors and implementers like us exit the scene. Barriers to ODFs haven't disappeared. You've all talked about them. There will be newer challenges that affect attitudes, efficacy, and behavior. Therefore, there is a pressing need for strategic, well-crafted communication efforts backed by commensurate investments, like media spends, other implementation costs, and logistics. And this is where support from the concerned government departments is key. No SBCC effort, and I cannot underscore this enough, no SBCC effort, unless properly supported and resourced, can really achieve the desired outcomes. My second recommendation is to make the invisible visible. Ruhi has alluded to this. Now, since 2014, the whole country has talked about toilets, open defecation, and today we are an ODF nation. That's huge. Yet, ask anyone what happens to their poo after they flush, and you will be met with a blank expression. Therefore, addressing knowledge, attitude, and practice around safe containment, disposal, and treatment of fecal waste is critical in urban as well as rural India. In 2017, we were given a new communication challenge by the Bill and Melinda Gates Foundation. Could we make fecal sludge management, FSM, an issue that is as important to people in urban India as air pollution has become? Could we get people to care about what happens after they flush? We knew we needed to link fecal sludge to something precious. And what could be more compelling than a link to water? And this has been borne out by several studies. This was also in sync with a national priority. We have done two things on FSM. A 26-episode TV drama called Navrangi Re, which was broadcast on Viacom 18, an independent impact evaluation, in fact done by OPM, shows that we were able to move the needle on knowledge, efficacy, and intent to act. There is also the 360-degree Malasur campaign, which has been launched by the minister at Mahua. Once again, ownership and support from both states and Mahua at the center are key to the rollout. I'm happy to say that despite the pandemic, Malasur has already been launched by over 115 urban local bodies. There are two lessons here. Building unique private sector partnerships, as we did in the case of Navrangi Re, and leveraging government support in the case of Malasur. We, in fact, have done a detailed toolkit to enable all kinds of stakeholders, government and non-government organizations, so that they can implement the Malasur campaign in any corner of the country. We really need to shine the light on FSM in the rural context now. We have to provide information, the information that Raman talked about, Raghava talked about, Ruhi talked about. We need to provide all this information that come out of guidelines and help people make the right choices on containment, cleaning, and disposal. As fecal sludge management becomes increasingly critical in improving the total sanitation landscape and outcomes of India, as FSTPs are coming up both in urban and rural India, behavior change and demand creation have to become as important in this conversation as infrastructure. My third recommendation is to use the COVID lens. India achieved its ODF status in a pre-COVID world, but now sustaining ODF and promoting other sanitation behaviors have to be seen through the lens of this life-changing pandemic. We know from consumer research done by Kantar that hygiene has become a spend more category, and behaviors adopted during the pandemic are likely to be maintained. They will become habits. So this is a huge opportunity for the Swachh Bharat mission, both rural and urban. The other side of the coin, however, is there is loss of livelihood and shrinking incomes. So financial worries will continue to dominate people's consciousness. We must also remember that people are moving from panicking to coping and adapting. Like a lot of our other work, we pivoted our sanitation work to COVID. And we did this in collaboration with our partners in DDWS. We created more content in the Shaucha Singh series. The new Shaucha interstitials focused on hand washing, no spitting, building toilets while maintaining social distancing, using and maintaining toilets, and storing water to keep it safe and clean. These are messages that have a life and relevance beyond COVID, but they were influenced by the COVID implications. They model situations and present doable actions to people, showing them how they can continue, how they can start and continue good practices, how they can cope in times of crisis and beyond. Therefore, SBCC for sanitation will need to be empowering as well as empathetic in the context of the pandemic. My fourth recommendation is that we should be using insights and data from other sectors for better informed SBCC strategies on sanitation. I have referred to the Kantar Barometer research earlier. It's the largest study on implications of COVID-19 done amongst men and women 18 years and above, NCCS A and B, from 25 cities, big and small towns of India. There is another study, a CPR research with smartphone owners in urban slums. Some of these insights could be very useful for designing SBCC interventions, particularly in a COVID and post-COVID India. And these are relevant for rural India as well because they can be extrapolated. Some of the findings are that new behaviors are around home, health, and hygiene. There will be, and hold your breath, 900 million plus internet users by 2025. Consumers are already spending 3 hours and 41 minutes on their smartphone daily. Biggest increase in WhatsApp usage, 48 to 59%, followed by Facebook, which is 42 to 49%. However, we can't ignore TV viewership because it has grown by 31% as of April 2020 across every single city and village in India. Doordarshan has became number one network after 25 years in this country. Remember when we were growing up, we were only watching Doordarshan, and then, it kind of was taken over by cable and satellite. Therefore, we need to focus on TV and digital, and for rural in India, we need to pay attention to community radio stations which have not been used optimally. We also need to customize content for platforms for an increased return on investment. To summarize, we have to stay the course on SBCC, but we have to do so by matching intent with investment of every kind. We have to expand the scope beyond ODFS and toilet use and get into other thematic areas. We have to factor in COVID implications. And lastly, we really do need to learn from other factors. If we don't do all of these four, then the hard-fought gains of SBM may be squandered, and that would be a real shame. Thank you.
Thank you so much, Radharani. So there's been quite an active sort of flurry of questions. Radharani has actually answered few of them, and that was really packed up with a lot of recommendations. So some of the questions have been answered, but there seem to be some which I'll try to take for a start one question directed to each of the panelists, and then let's see how we go for time. So first, in the context of the discussion which was raised by Raghava Niti. So Raghava, this question is directed to you. You suggested that, we need to have a lot of sort of institutions which play a role. So the question that is being asked here, given all the problems that are being raised with emptying of pits and, disposal and things like that, what do you think of arrangements being made by the Gram Panchayat to empty pits rather than leaving this to individual households? So that's a question to Raghava.
Okay, thanks, Ruhi. I think this is where it is important to ensure the lower rung of our institutional system, which is the Gram Panchayat. Okay, so in the whole of ecosystem, under the Panchayat Raj system, Gram Panchayats are important. So in terms of their role in emptying the pit, one, of course, that we see that the Gram Panchayat presidents keep changing. Along with that, the political system in the villages also keep changing. If one president does something, other president will say, no, I don't, I will tell them. Okay. So we need to, first of all, understand those dynamics and then try to help them to understand the importance of emptying the pit on a regular basis. Second, to be able to do that, they may need some kind of support in terms of infrastructure required, and then understanding of how to use this thing which is coming out of the pit. In your study also, it came out that people don't understand when to empty the pit. That thing is very important to transmit. That knowledge is important to be transmitted to the local level. Okay, who is there in the Gram Panchayat? It is the president, then the members who are elected, and maybe some subcommittees who would have been formed within the village. we have seen number of committees like water and sanitation committee, health and hygiene committee, and probably on the agriculture side there may be some other committee, etc. Number of committees are being formed. So it's important that even within the Gram Panchayat system, somebody is made responsible and roles and responsibilities are clearly designated. In our project, we try to ensure that it happens properly and it is monitored regularly by higher levels of the government. Thank you.
Okay, so looks like in answer to that question that there is some space for involving the Gram Panchayats in this task rather than leaving it just to individual households. A second question, which of course you talked about this, Raman, but this is sort of giving you a kind of, putting you on the spot to say which is better. So the question is, what is more practical? Having twin pit latrines which are managed by households who manage the emptying and whatever. So it's managed on site. So is that more practical? Or fecal sludge treatment plants, even in rural areas or in semi-urban areas that serve the entire area? So what is a better way to go? Of course, the SBM was sort of, focusing on the former, but then how much that worked is open to question. So
I think it's an important question, and thanks for that. I tried to write up very quickly on that, but there are some details to it as well. One, the specific understanding that the fecal sludge management or the sewage treatment plants in the urban areas are connected to the sewage system, and that the sewage system takes the fecal matter directly to the plant without having an intermediary of emptying, cleaning, emptying, transportation, etc. So, but in the rural area, the economic viability of sewage system is a important consideration that we need to look at, and that is where a mix of some of the on-site systems may be required. Unless we can make a viable economic model of the cluster of panchayats, and they are thinking about, and in between there are agricultural fields and all that. So the distance of what the sewer lines needs to be covered in a rural setting will be very longer compared to an urban area. This is something to be looked at. And small bore systems and related technologies, how much it is feasible in the rural areas also needs to be considered. So with all that, this in the current situation, we are in a slight mixed kind of a thing, wherein you need household level systems, but it cannot be just a twin leach pit system, because in flood prone area, river banks, high water table areas, hill regions, and many places would not, the twin leach pits as an on-site sanitation solution is not going to help these areas. So you need to be very area specific, and terrain appropriate thinking needs to be there. So where you require, where you can go with twin leach pit technology, we need to clearly earmark them. And then where we need to go for a mix of toilet substructures, collecting it, and then periodic emptying and transportation and treatment at the FSTPs happening, that needs to be clearly laid out. And so, in this process, also important is, sometimes the repair and retrofitting of the toilet also would require in this process. So we need to have systems and systemic solutions for that also, wherein the mindsets and caste related issues can create issues for opening the used toilets, repairing them, those kinds of things as well. And regulatory measures also will be important at the rural areas, wherein guidance for while you have not necessarily all the rural areas would require FSM, but we need to really understand which all areas would require FSM, and we need to have financing for that. As Raghava said, we need to have Gram Panchayat or clusters of Gram Panchayat, and roles and responsibility for all, clear kind of demarcation of things. All that need to follow. So I think there is a mix, that would work for this setting. Yeah, thank you. And also operations and maintenance is another important factor that will come in for this purpose. Yeah. You're mute, Ruhi.
So the third question is for Radharani. So you talked about, how there's going to be increased usage of telephones and different sort of social media and devices and all that. So this question is a bit linked to all this information which comes in through all these venues. Apart from these, on the ground also, the question is that there seems to be a lot of information, and we're seeing this with COVID as well, which then results in kind of information fatigue. So in the context of sanitation, how does one deal with this information fatigue on the ground and actually have these sort of targeted SBCC efforts to have an impact?
I think that's a really, really legit and a very interesting question. I'd first like to say that there is a difference between just information and communication. And I think truly strategic communication would unpack something, pick out the barriers and motivators that need to be addressed. And I'll take an example from our Shocha work that we did post-COVID. So, we have been talking about, in the earlier series, we talked about building of toilets. We really unpacked these barriers and addressed each and every barrier in that series of 10 interstitials. When the unlock period started, in fact, even before the unlock period started, certain essential services had been opened up, if you people remember, and building toilets was one of them. So masonry was opened up. And we felt that we really needed to equip both householders and masons, but our interstitial was targeted specifically at the householder, to let a household know how they can get back to either repairing or building a toilet, bearing in mind the barriers that COVID has brought in. For example, social distancing, and prioritizing the fact that wearing of masks, maintaining a distance of 2 meters, all these have to be absolutely borne in mind before, starting the building of toilets. So we need to look at the entire sanitation chain. So for example, maybe there needs to be a little bit of a stop on, promoting, going to toilet for defecation, but there are other things. So for example, we have heard both Raman and Raghava talk a lot about how we have to co-opt gram panchayats in fecal sludge management of fecal waste in rural India. And there is a huge opportunity there, to work with these local rural bodies, governance bodies, so work at their level. The work that we are now doing with Swachhagrahis, they need refreshment of the knowledge that they already have. They need to know how to use better their interpersonal communication skills. So in terms of the entire gamut of social and behavior change communication, there are lots of opportunities that are yet unmet. And in order for us to do that, we need to have theories of change where we figure out what is it that we need to communicate about? What are the barriers and motivators? Who do we need to, which segment of the population, communities, systems, organizations, does this communication need to reach? Then what are the platforms that we would be using? So an entire theory of change that would map out the indicators that we have to work on and the platforms we would be using and the thematic focuses. So I do agree with you that information fatigue is there, but there is a lot of other communication that needs to be done, and the time is now. So we need to address all the things that haven't been talked about and which we have talked about in the last, 50 minutes. Does that answer your question, Ruhi? The question
more for the audience, yeah. So yeah. Yes, and so I think we've sort of reached the end of the time we had allocated. There are some more sort of popping up, some comments which are very interesting. There are also some more questions which are around the issues of gender, caste, the use of, shaming people to get them into using toilets. So a lot of issues, but unfortunately, I think for today, we only have time for this. And I hope that some of you who have given questions have received written answers as well. And some of these will be answered when we put together a piece from this webinar. But bringing it to a close, thank you so much to, first of all, the panelists for agreeing to join us. Thank you hugely to the audience, of course. That's really nice to find so many people still, interested in joining webinars. And thank you so much. I hope at the end of COVID, we'll remember the word seminar and not just begin using the word webinar. So with that, thank you very much. And we bring this to a close.